Good morning to you, listeners and viewers around the world. I know some people are surprised to see me this morning because they didn't see me last night. I I had a night, I had a night off for medical reasons, of course. Um, I have to, I have to go check with the physicians this morning. In relation to some people were saying the other night that they observed that I was wearing two seat belts. Some people said they saw me wearing two seat belts. I don't know. That wasn't a seat belt. It was a shoulder strap or shoulder brace, as they call it. So yes, last night I was not on. I was not at work at all. I would be checking in with the medical people in a little bit. But I mean, one's got to do what one's got to do. You know. So I'd like to welcome you all this morning to the In Perspective show. As usual, I like to give you a little brief as to what the weather looks like. At the moment, it's 68 degrees here in New York, at least in the city. It's 68 degrees. It's going to be a very, very hot day, sunny and hot, exceptionally hot day today. I'm told that we were expected to hit 86, 86 degrees. Yesterday was the hottest day of the season, or hottest day of the year so far. And I guess the hottest day since what, maybe August or June, July last year. Um, August, sometime around in August was pretty hot. Um, Today is the hottest day since then. Then tomorrow we're gonna cool off a little more. Then the other day we're gonna stay a little, and then on I think Thursday or Friday we're gonna hit it again, 86 again. And this time the night will be a little warmer. Tonight should be we should be at a low of 51 degrees, and that's not low. That's still high. But on Friday, I think either Friday or Thursday night, um, we should be. I think it's Friday night or Saturday night, somewhere around there. Over the weekend, I think we're gonna be at let me see when it would be on Sunday night. Sunday we're gonna be at 86 degrees again, and Sunday night we're gonna be at 61 degrees. Wow! So we're galloping towards the summer. In Guyana, it's 80 degrees currently, 80 degrees Fahrenheit, and I'm told that Guyana is expected to go. The temperature in Guyana is expected to rise up to a nice 84 degrees. So for the first time in a long time, we are going to be having warmer a warmer day. Well, I shouldn't say a hotter day than Guyana. So today is the day when I should have had Mr. Patterson on so that I could have teased him because we've got the ball in our court today. All right. Nevertheless, it's a good day. I'm so happy to see you folk. Um, share the link and let people know that we're in the house and have them rock and come in, as my boy Andrew Weeks would say. Let them rock and come in. It's time for them to rock and come in the come in the house, right? Lending us today, like I promised on when was it? On Monday night. We're gonna have an interview with somebody from Linden, or at least out of the Region 10 area. Region 10 has been known to produce some very outstanding Guyanese. We've got names such as Miss Kissoon, we got Mortimer Mingo, we got Sharma Solomon, we've had Sandra Adams, and the list goes on and on and on. The other day I spoke with um, Mr. Vincent Adams, I think it was, if I remember correctly. Another stalwart out of Linden. So lots of good names coming out to Linden. You've got footballers coming out to Region 10, top national footballers. I had the pleasure of interacting with one. I don't remember his name. When I was managing the East Demerara Carib League team. And then there's another. I don't remember these guys' names now, but there's another footballer whose image is splashed across some places in Linden and some places all over Guyana too. So lots of big names coming out of Linden. But today we're going to have a discussion with another big name out of Linden, a gentleman by the name of Deron Adams, and he's the chairman of the region. Region starts somewhere on the west bank of the Borbis River and kicks right over onto the east bank of the Essequibo River. To ask me from where to where, I know region 10 starts from somewhere around Moblissa, going back how far back I'm not sure. But Mr. Deron Adams is going to tell us all of that this morning. Mr. Adams, good morning and welcome to the In Perspective show.
Hey, good morning. Good morning, sir. Thank you for having me on your program. It's an honor.
Well, it's definitely a distinct honor to have you on the program today. And this is a program on which we share news, and of course, like we're doing right now, we have interviews, and we keep people, especially those in the diaspora, up to date on what's going on in our beautiful country. Of course, I am speaking with you out of New York City. Mr. Weeks is in Georgetown, being the man on the controls there. And you, of course, are in somewhere in Region 10. I don't want to speculate and say Linden because I might be wrong, but I know it's in Region 10.
Yeah.
Um, what's your territory looking like? I mean, how large a territory do you have to manage?
Well, as you know, Region 10 covers a vast number of communities, areas in the Berbice River, for example. You have Weruni, Kimbia, Gateway, Develt, Sand Hills, Hururu, Weruni. Um, then you come down, you have Kokwani, Aichoni. You come down Kokomaka. You have the communities there, Siberia, Old England. Then you come into Mackenzie, Watuka, Central Mackenzie, Amelia's Ward, Retrieve Karakara. All of these areas. You go on the Wisma Shore, you have Christianburg, you have Silvertown, you have the alleys, first, second alley, and third alley. You have Kansas City, and then you go Wizrock, Block 22. You have Rockstone further down. And then in the Essequibo River, of course, you have places like Rivers View and Falmouth, right? And that's closer to Bartica area.
Right. I know definitely. I learned a few years ago when I was working at the Guyana Conference of Seventh-day Adventists. I never knew that before,
Yeah,
that we have a large campsite at Goshen, and I
yeah,
learned then that Goshen is in Region 10, and I'm like, well, how could Goshen be in Region 10? But we had a little land issue, and we had to end up at the Region 10 office to get that matter sorted out. So
yeah,
that's a very large geographic area, extremely large geographic area. Not as heavily populated as Region 4, but it's still a densely populated area. I think of all those communities, the Linden area might be the most densely populated. I'm not sure if that is accurate, but I know you
yeah.
also control two bauxite mining communities.
Yes. Well, the privately owned one, both are operated by the Chinese, and that's still operational. Of course, Rusal, they would have closed down, sending home a
Yeah.
large quantity of workers. So we were hard hit. Of course, they had the challenges there with those folks from Rusal and the way they treated workers.
Mhm.
Um, and so they had their challenges, and we're hopeful that an investor would come and take up the mantle of providing opportunities and employment for the people there as well.
Wonderful, sir. The beauty about local government is that you are able to monitor things happening in several communities at the same time,
Yeah.
and you have this network. That's the extreme beauty of decentralizing
Hmm.
government. I want to focus on there's a particular problem we have right now, but I don't want to go there as yet. I want to focus on the administration for a little bit. Government, I think Lyndon Forbes Sampson Bonham back in the day had decided that it was a good thing for them to decentralize government and
Hmm.
have the government ministries represented in every geographic location. The current party that is an administration government at the moment took office the first time ago in 1992. Between then and 2015, they kind of pulled back some of the authority given to the regions, and then those bits of authorities
Yeah.
were given back in after 2015. But we're noticing again, based on the information that have come to my attention, that the government has once again started to pull back those authority, those levels of authority given to the administrative regions. What is your challenge in terms of treating with those issues and how the government relates to the regions?
Well, I will tell you, and you're correct. In 2015, or since 2015 up until 2020, I should say, local autonomy under the coalition, we were giving that, we were empowered um, by what the officials would have done. And we were giving that task and that mandate to spearhead development in our region. When you look at documents that we were tasked with compiling, like the PAR, the Plan of Action for Regional Development, which strengthens and today it complements the vital role the Regional Democratic Council play in coordinating initiatives that could accelerate development in the region, and it worked. So under
Mm-hmm.
the coalition, we saw PARD coming to life. We saw attempts now, fast forward, by this administration to shelve PARD. They're not interested in ensuring that that document reaches its true potential, or is executed in its full capacity here. And so we have them now shifting that authority that we were privileged to have at the local level, now being controlled by central government. So you have the minister making statements like, oh, the regional, the executive officer answers to him and he dictates what should happen. Not the way it should rightfully be, where the executive officer carries out the lawful functions of the policymakers, who are the councillors. So clearly, we are going back into, we're slipping back into what I would say a dictatorship. And I can give you an example. Flowing from the consultation we would have had with residents here in the region, we would have crafted the budget, the 2021 budget, based on those discussions. So we did community awareness programs. We went around into the communities. We were meeting with persons in Christianburg, in Amelia's Ward, in Retrieve, in Kokwani. And based on what these persons would have said they wanted, we made sure that those were placed in the budget as priority. What had happened as recent as January, the administration would have taken that document, edit it, they slashed the office of the regional chairman's budget, for example, from what we would have gotten in previous years. The disaster relief funds that was catered for, some 5 million was slashed to 3 million.
Oh,
And so
wow.
now we have a situation where persons are affected by the effects of the weather, the pattern there, flooding in Kokwani. And so there's limited resources. And to date, despite them doing all that, you have not seen Bishop Juan Edgel, who I believe holds responsibility for this region, who is in charge of public works. We have not seen him visit the region. He has not even made contact with the councillors for the area or with the office of the regional chairman. We at the RDC level would have contacted the Civil Defense Commission. We were able to make representation for them to get some amount of cleaning hampers, because coming out from floods, you have all kind of things you can likely deal with leptospirosis and all of these things.
Mm-hmm.
So we were able to get the CDC to coming, but to date, we have not seen any response, any intervention by the administration, which is sad, right? I have placed strategically councillors from those areas. In this council, you have 2 councillors from the Kokwani area. They have been giving us information. We have been trying our best to engage the administration. We have written a number of letters. We do not get any response from them. And so we cannot clearly say what is the position of the government as relates to relief coming to the people of Kokwani at this time. And that is a sad situation.
Yeah, that's sad indeed. Even as Andrew shows us some footage from the area, I learned of this. I'm going to jump straight into that issue right now too. I learned of this situation via a Facebook post from someone in the area. I have a friend in the area who has lost his mother I want to say publicly, I wish to express condolences to Anson Mickle and his siblings and other relatives on the loss of his mother, Ansa Mickle. And Ansa, I learned through a post that they're flooded there, and even even as they looked at the situation, Ansa was trying to determine how they're gonna figure out, or how they're gonna go about burying this lady, because it seems to me as though even though those areas are considered to be kind of high and hilly, one has got to remember that our rivers start high and go down low to the Atlantic Ocean. They don't just start at the very low plane and then rush out there. It comes from high. So even though Kukwani and those areas are considered to be higher in plane than the coastland, of course, when the river swells up there, people are going to be affected. So it's kind of disturbing that your budget was slashed, and you have a situation where there is absolute need for funding. And as I look at the footage, that is serious, because even the riverside sheds, people have sheds at the riverside, boat houses and so on. Those houses seem to be covered to some extent, many of them. So how are you going to deal with this situation here? I mean, the CDC, you said, is in there and is trying to do their best, but generally, that's sad, man. How are you going to deal with it as a regional administration?
Well, one of the things that we have come to learn, and the council shares this view, is that we will not sit down and allow this government to oppress people, to disrespect them. We have been engaging, just like what happened with the PPE gears for the nurses. We did not wait. The hospital is over 80% drug shortages. This is 9 months into the administration or so. What we did, we engaged our partners in the diaspora. We were able to get PPE gears, face masks, shield, hand sanitizers, whether it's stethoscopes, whatever it is. Um, we gloves, gongs for our healthcare workers, and we have been making those contributions, donations to the various health centers, to the Upper Demerara Hospital, and even to the Linden Hospital complex. It falls under the Ministry of Health, but I always say there's no politics in health. So whenever
Yeah.
I receive medical gears, I would take it to every hospital. Just last month, we would have donated a number of the temperature guns for testing. However, what I've noticed is, despite us being closest to our southern neighbors, Brazil, who recently would have seen that new variant of the COVID-19 virus coming in, we have seen this government remove all of the locations that we were doing testing. Um,
Wow.
and so that places Region 10 at a greater risk. While they're doing that, clearly the administration doesn't have a plan in place. The regional health officer is out of, I don't know what is going on with him. Region 10 has only been seeing 10% of the vaccination. There is no PR of those who are ignorant to the vaccine or whatever. And so persons are not aware, and so we're lagging behind, and there seems to be no clear plan in place for us to increase and to bring information to people. And I'm concerned that they would have opened up that area. They removed all the persons that were the healthcare workers, fire them, send them home, that were doing testing at these sites at Rockstone and at Bamia. So there's
Hmm.
no they're testing the temperature for persons coming into the region now. Under the coalition, we had flattened that curve. Um, we had seen persons, we're begging, we've seen a number of dormitories, um, students being tested positive for COVID-19. We just, the Ministry of Education, the Department of Education, a staff tested positive just this week. Um, you had the Linden Foundation, Mackenzie High School, students testing positive for COVID-19. And it is only after we would have engaged, I would have written the education minister asking her, what is the plan going forward? How do you intend to deal with this? Because it seems as though things are spiraling out of control. We just recorded another death in Kokwani, and we have not been getting any response. We had to beg the regional health officer to update the Facebook page so that we can see what are the numbers. There are over 1,000 active cases right now in the region, with no clear plan in place as how we're going to deal with that. And it's sad.
Yeah, that's indeed extremely troubling, and that they know brings another dimension into the whole equation, because if you're already dealing with the COVID-19 pandemic, and then now you've got to deal with a flood, a serious flood
Yeah,
in the Kokwani area, where you already have people feeling the effects of the pandemic, then
yeah.
that's disturbing. And then, as you mentioned, I am not sure where we're going in Guyana, and like I'm gonna say it on air again. I have invited the Minister of Health twice, two times, to come on this show and help Guyanese to understand, one, the dynamics of the virus, and two, the help them understand the nature of the vaccine, because people are skeptical. Lots of people are skeptical. And then I saw one of my good friends yesterday posting on Facebook some sad situation where some teacher on the quarantine may have had other um, complexities in terms of her health situation, and she passed subsequent to her taking the second shot of the vaccine. And he put it out there, kind of giving people the impression that the vaccine killed the woman. So I've asked the Minister of Health to come on here to explain away all of these fears, and he has so far refused to do so. So now you're in this critical situation. I am not sure how you're going to deal with this, man. I mean, telling them people what hope they have.
Well, I'll say this to you. The Minister of Health, and I read an article where advice came from PAHO, I think it was, where they advised that a new variant is possibly in Guyana. They would have recorded that. I think Newsroom carried it. But the minister was completely oblivious to that fact. He said he was not aware of that, and he would have asked them to submit the information, the data from where they were speaking from, reporting from. So um, clearly, as I said, under the coalition, this we were handling the COVID-19 situation better, that administration, because there were various consultations that were had with the people. You had everyone on board. In fact, the vision of the then administration would have seen the current administration reaping those benefits by the very construction of that center there at Lillian, at Ocean View, the
Hmm.
very center that was criticized and condemned. And,
Right.
and when you look at countries like Trinidad now trying to scramble to find a facility as one that we have here, it tells you that the previous administration was on point. They knew exactly what they were dealing with, and they plan ahead. Clearly, we have seen a change in direction, a change in policy that is not in the best interest of our people, and that is of concern now. I can only encourage the people of Region 10 to, one, continue to wear their mask, social distancing, continue to sanitize. Let us continue to be responsible. That is why I've been speaking out for those. You've seen people who are aligned to the current administration getting a free pass in holding parties and
Hmm.
not turning up when the magistrate send for them. And so clearly, you know, the powers that be, these people are hiding behind this kind of, this shield that they can get away with these things and not be held accountable. And that will only lead to increase in deaths and increase in cases in the region. But at the regional level, I'll tell you this week we'll be convening a meeting with the leaders because we will likely have to take a position if this administration is not willing to listen and to hear and to take advice from the team here in Region 10.
That's extremely sad. One of the things that I've observed is that Guyana, well, I mean, in America here, it's kind of the same or similar, but I have been saying that in Guyana we have the unique position of having the being at a vantage point where we can look at the rest of the world, and in my view, learn from what they're doing, or what their bad experiences are, learn from their missteps and so on, and improve. So it's kind of shocking to me to observe still that Guyana is not making any effort I think the government should be in the lead to reduce the possibility of people in the medical field being exposed to this virus as much as they can. And at locations, I feel even in private sector need to step up the game and ensure now that people who do not want to protect themselves and protect the other members of the community are forced to stay out of the business places or stay out of those locations. So, for example, in some places that you go, especially in the federal buildings, all federal buildings that I visited between the time of this COVID-19 beginning to now, I've observed that the government here, both local, state, and federal, have ensured that they have these either wall-mounted thermometers or thermometers on stands that they take a temperature from your forehead. You just stand before it, put your forehead close to it, and it reads the temperature. And some of them are connected to the computers in the system that feed the temperature straight back to the person who's monitoring it. So there's no contact with you. You don't have to touch it, but they read your temperature. And if it's not nice, they tell you that you can't come in. I
Yeah.
think we've got to step in that direction. I have I have one in my shopping cart that I intend to purchase at some stage within the next week or two, and send down to my former place of employment before I came up here, the Guyana Conference of Seventh-day Adventists. I intend to get one, secure one for them, and they can have it at the door so that people going in, everybody going in needs to take it. Guyana needs to take this thing seriously. I don't know if you'll be able to see it, but this is what it looks like.
Yeah.
This is what the device looks like, and
Yeah.
I can send the link to you. There are lots of them. It says Skin Defense K3 automatic temperature monitor. It uses the infrared technology to read the temperature. So Region 10 can take the lead and show the rest of the country that this might be the best way to go for now, because to me, standing close to someone and shooting them in the forehead is still put yourself at risk. And then not everybody's comfortable with you shooting. The other thing is that I see people in Ghana still hitting people on the foreheads. The World Health Organizations have already figured out that the same temperature reading that you can get on your forehead, you can get it on your wrist.
Yeah.
So you can hit the person's wrist as well, and take it. Do whatever, man,
Yeah.
chairman, whatever
Well,
is necessary to
they,
get rid of this thing.
well, as I would have mentioned, the temperature guns that we recently brought in, those are the ones that we donated to the hospital. You can test it from the palm, from the hand, and
Uh-huh.
so you don't have to necessarily point it to the person's forehead. So we donated that to the hospital and a number of health centers, and I know they're using it. The other one that you just mentioned, we will look at it and see how we can expeditiously bring it into the system.
Yeah, the price range is from $99 to 140 $50 US. So
Okay.
it's not a whole lot. You just buy it and place it at the entrance of your
Yeah.
facility. So that
Okay.
everybody comes in, they just stand there for 10 seconds or 5 seconds, beep, and they're gone. You determine whether they can come in or not. I mean, that to me should serve as a deterrent or an incentive for people to go and get themselves checked or take the vaccine. Because, for example, if I need to go speak with the regional chairman, and before I get into the regional chairman's office, I am required to check my temperature, and my temperature is high, I can't go see him. And I know that whatever I want to go see him for is very essential to my life, and I can't go see him. It means that for me to get to go see him, I need to go attend to my health.
Yeah.
So it should help in this whole exercise. And it's kind of mind-boggling that, as you said earlier, I want to get back to that. The fact that the government has chosen to close down the testing sites. What's
Yeah.
that? What's that about? I mean, like, I don't understand.
We have written asking why we've asked for us to go back on rotation, for example. Staff at the administration would have tested positive. And so we would have asked that we go back on rotation, reduce the traffic through the building. We are operating in a cramped space.
Hmm.
The contract for the new RDC building was cancelled. And so we're hoping that it can be placed back into the budget. Um, but we've been making representations, speaking, we've been writing, we have not been getting any response. And this is of concern now. As leaders in the region, we're concerned about where we're headed.
I am definitely concerned as well. I have a lot of friends in the Araima, Kokwani, Develt area. Listen, when I worked at the Ghana Conference of Seventh-day Adventists, I had the distinct honor of working with the people in um, those areas, those communities. I visited Kimbia, I visited Develt. As a matter of fact, I stopped at all the major Seventh-day Adventist church locations along the Borbis River. I visited Friendship on a number of occasions. I have never gone into Kokwani proper. I was invited a couple of times, but never got the opportunity to. But even before then, I visited this Farfan and Men's Farm. I don't remember the name of the place right now, but they've got a big farm in the back there in the Borbis River area. There, I think it's in Region 10 still,
Yeah,
even though it's right up to at the
far.
back there. Pardon?
Things far fun and men.
Yes, they have a big farm in the back there. I don't remember the name of the place, but that's a very nice riverine area there at the back of Bobby's River, and it's sad that we're throwing those people away. Just coming back to the flood situation, I understand that you were in the flooded zone up to late last night.
Yeah.
What Give us a sense of what is taking place there?
What has happened is that the councillors who represent the area have been reporting to God. Actually, I think one of these videos, I would have asked him to go out and do a video of what is happening there at Kokwani waterfront and the Lamp Island area. Also, Hururu and in the Araima, Laddersville area, they're affected. A lot of agriculture produce have been lost, farmers. And as I said, what is sad is that we have not got a response from the administration, from the government. Bishop Juan Edgil has not, I haven't seen him visit the area. He was here frequently. I don't know why he isn't coming now, but this is the time he should come and visit the people at Kokwani there. But so far, the water is still high at that level up to yesterday at 1 o'clock when I saw the area. And we made contact again with the CDC and the NDIA. And we've been asking them, what is the plan going forward? What relief will you bring to these people? And that, of course, within the past 24 hours, I haven't received any update from them.
I don't know. This is terrible. When you check the record of the current administration, I mean, I'm not bashing anybody. I'm not banging anybody. I'm just making known the facts. The track record of the current administration when it comes to dealing with flood situations in Guyana is very, very poor. I had my own experience with them in the 2005 major flood on the East Coast, and subsequent floods. It has not been. They have not had a good track record. They have some very good officers within the Ministry of Local Government who have done a lot from their own professional standpoint. I don't want to mention names, but I can. But some of those officers are very, very effective and efficient. But then they can only do what they can do with what they're given, the tools they're given to work with. That's what they've got to make do with. So we want to call, like you. I want to join the call and ask the um, minister of, what's it, public service and public infrastructure, whatever he calls it, to make his presence felt, Mr. Warner Jill, who I remember him going into the same area. I think it was on the other side. Um, was it? Yeah, I think it was on the other side during the elections campaign when the people chased him away from there because he himself and
Yeah, I was at
the prime
Laddersville.
minister. Yeah, I mean, they only choose time, opportune moments to go. This is an opportune moment, so we're calling on the minister to get his team together and go. This is an emergency. They need to get there. What levels of water are we talking about on the land, Mr. Chairman?
Um, the last report I got that we're a couple of think about 8 or more. The water is very high there. I can tell you that. I'm actually waiting on an update from the counselor to give me. I don't want to give you information that's not accurate, but
Mhm.
what I'll do as soon as we get it, we'll hold a press conference so that persons can be up to date with what is happening. Right.
Yeah, we be. Mhm.
So the vice chairman as well, who has responsibility there, will be in contact with me during the course of the day to give me an update on what is happening there as well.
All right, so we look forward to getting some information on that situation. But I mean, that's not to say that that is not important, but you have a whole region to manage. So I like to segue a little now and look at the nurses situation in Linden proper. Well, they I did speak with the mayor of Linden last week, and I asked her what's the situation with the nurses. She did her best to give us a little update according to the knowledge and the information reaching her. But then she made it very clear that she doesn't have responsibility for the health sector. So, from your vantage point, what's the current situation with the nurses? I noticed that they said in a press release, I think a press release about 2 weeks ago, that they were forced to end the strike because of a number of reasons, but they did not get the level of support they thought they would have attracted in this effort. What's the status of this strike action and the present situation with the nurses?
Well, I think what has happened, indeed, the level of support coming from amongst their own colleagues is one that was dismal. We would have said to the nurses that we stand with them, that we support them. We were out on the ground, standing in solidarity with them. But you had a situation where some nurses were not coming out, and I now understand the reason why, because many of them got their salaries slashed for the month of March and even April. Some of them took home as little as $3,000. So clearly, you're using that tactic to intimidate them. Many of these nurses have bills, they have commitments that they would have made, and if you use that strategy, of course you're going to see them backpedaling. But the situation there, and I say this because the community at some point will likely they get involved. They have been calling for the support, the nurses, and the community may at some point um, join this call, because we're seeing a pattern being taken by the administration. You recently heard of the closure of the nursing school. I'm disappointed by the announcement made by the Minister of Health. Clearly, this administration is not interested in youth empowerment and development, because the administration, of course, in its action, I would have said they need to take their knees off the necks of young people who are aspiring to take charge of their lives in the region. We have seen them go after the National Data Management Agency youth, firing them.
Hmm.
They're young people that were hired in 2018 and were doing digitizing Guyana's information. Over 200 million, close to 200 million over a period will likely be has been taken away from the region. We have seen the other programs that they were involved in, the St. John's Ambulance Brigade that provided assistance to patients, an organization that was around for 50 years, being the contract not being renewed, and they sent home all of those persons. Look, we would have been encouraging young people to take action in order to enrich their quality of life. And over the past 5 years, we would have achieved that. We would have gotten them involved in programs, whether it's training in ICT, encouraging them to get involved in a nursing program, in creating the patient care assistant program where 60 young people were employed here in the region. And we would have encouraged them to take action and to enrich their lives. And after 5 years of achieving those positive action, youths here in Region 10 again by the actions of this administration, who seems not to be caring in their actions and carefully thinking of what they're doing before they activate them, which clearly shows that young people should not and cannot trust what these people come and tell them. You have Bishop Wanajil coming into the region. He wants to hold youth forum. He wants to invite them. He's encouraging young people to come and sign up for the Goal Project. But then when they turn up, only a handful are actually being given the information and getting to sign on and qualify for the program. So you're misleading people. So the quality of the relationship between youths, our healthcare workers, and this government has deteriorated over the past 9 months. I can tell you that in a nutshell. They're not supportive of job creation. They have fired youths from the NDMA. They have dismantled the Bertram Collins College of the Public Service. The dormitory that is being built at the Linden Technical Institute that would have seen young people coming out from places like Rockstone and Wiruni and Kimbia who wanted to do a course in mechanical engineer or information and communication technology. They have suspended the construction. I don't know what the plan is for those children who are involved in that TVEC program, who are hoping to join the program. So all of those programs have been canceled. We have seen even initiatives that the Darfur home that was refurbished under the coalition. They attempted to kick the old people out, the senior citizens out, and convert it into a quarantine facility. And it's only after the residents stood up, they would have backed off. The dialysis center that was set up under the former administration was lying there for close to 8 months. We have patients here who are suffering from kidney failure, and we would have been making representation, writing. Well, I'm happy that only last week I heard that the contract has been signed so that those persons who are suffering from kidney failure here in the region do not have to travel all the way to Georgetown and to Woodlands and Dubai to do simple dialysis sessions. But these are the challenges that we have been facing since September. Over 80% of the drugs in the hospital, and there are no drugs there, down to cotton wool, hand sanitizers, tablets that patients need. They all have to go to private facilities to order these things, and it's bringing more hardship on the people here in Region 10. Sad situation.
You know, as you spoke there, I was making some notes. This is, this is, this is unbelievable. One of the let me just go these points as I wrote them in chronological order. One, it seems to be that there is a deliberate move, as you would have alluded to um, remove. As I don't know what Sarah Lynch is doing in Guyana. She's talking about democracy and democracy. There should be a deliberate and a concerted effort on the part of those of us who are here in the diaspora. I know I am going to join that cry now in a more serious way. To get Sarah Lynch removed from Ghana because she's not representative of a democratic government, the democratic government that we have here in America right now. She's not. Because I'm saying, if you are going to remove the right to strike from people, that is a sure sign of the pulling of the plug on democracy. That's one of the biggest pluses of the democratic society, workers having the right to resist and make their opposition to bad treatment known.
Yeah, but you know what's sad, and we need to look at it in this context. The nurses were not striking for an increase in salary. They were striking because of disrespectful comments made by the CEO, which had the potential of causing massive problems among families. A nurse who works on a night shift and the colleague that has to relieve her might come in late, half an hour late. He said that these nurses would sign in and then leave and go and sleep with a sweet man and then come back to the post, and sign out, logging back. Now, understand the social impact that can have on somebody that, you're a husband at home. He makes those statements, it start playing with your mind. So they were asking for him to be removed. He was sent to the region after being removed from 2 other locations, I guess, because of his attitude. So They clearly ignore that. However, when you look at that in comparison to sugar workers who went out for a week or two and strike and then got 200 million, and then GPL workers who went out and strike the very week and they got the attention of the government. Why is it that the same level of attention was not given to the people here in Region 10, to nurses? Look, a company in the US went and started building a cement factory without the permission from housing. And the guy might have railed up and talked a little harsh to the Minister of Housing. Immediately, they intervened and asked him to leave the country. And the statements that that gentleman might have made as a foreigner, mind you, while it's disrespectful, compare that to the statement that Rudy Small would have made to nurses. And the domestic violence that we're experiencing here in the region, how it can impact that. And you have no response, no statement. You have one man making over 400 nurses uncomfortable. One man, when you could have simply removed him and let us move on with the development or the agenda, whatever it is you wanted to promote in the region. But clearly, it's Region 10 we're talking about. You look at the Linden Music Corps, a group of young people, a planned program of music and education, Mr. Burke, designed for the purpose of aiding and enhancing the personal and social development of young people. They learn to play the saxophone, they learn to play the drums, and they would normally play at events that we had, national events, playing national songs, marching in the parade when it's independence or we're celebrating Mashramani. And you defund it, right? They were just doing it voluntarily. They were getting a stipend. You issue a memo, you send them a text message saying that you will no longer fund it. And then after we started to bring it out and publicize it, you attempted to backpedal. But the whole plan was for us to initiate and to train those young people. They had over 100 of them in the program. And then we set up the Lycius Hall where we converted into a music school so that more young people who want to get involved in music can come and learn an instrument, whether it's the drums, the guitar, the keyboard, the saxophone, whatever it is. We are not getting the support for any of these programs. Yet, the debt ceiling has been increased. The domestic and the external debt ceiling was increased, which means that they're going to be engaged in massive borrowing, maybe just to fund the sugar industry and not focus on youth development and youth empowerment. Why would you suspend a nursing school, the operation, only in Region 10? No other region has seen the suspension. In another 5 years, Guyana will likely need more than 3,000 nurses. While around the world, countries are magnifying the efforts of frontline workers and nurses, you have a situation here in Region 10 where nurses have to be protesting, have to be pleading with the administration to provide the resources for them. Those nurses who are currently in the Charles Rosa School of Nurses would have just invested heavily in the medical books. I can tell you because I donated medical books in the past to them. Fundamentals of Nursing, Principles of Anatomy and Physiology, Medical Surgical Nursing. These are books that cost thousands of dollars. And after they would have invested in those, they left their jobs to join the program. 2 months into the program, you come and you shut it down and you tell them, well, you know, Region 10 is overstaffed or whatever is the excuse you give. Oblivious to the fact that in another 5 years, we will likely need nurses. Why not train them and allow them to maybe go, and if they want to leave and go to another country, at least they have the certificate that they can show in another part of the Caribbean. You speak of the CSME and bridging, getting involved in regional integration and all of these things and getting persons. I can't remember the term that they used to use, but why can't I as a nurse study and then take my certificate knowing that I have it and go and apply for a job in St. Vincent or Trinidad or somewhere? Why would you deny me the opportunity to train and then just leave me on the breadline just like that? Come on, it's unacceptable.
So, Mr. Chairman, when you look at all of these things, you spoke of the national data people. I mean, like Guyana is right now in maybe at the stage where America or these other developed countries were in the 1920s or the 1930s or the 1940s when it comes to computerization of the national data. And if you have a group of young people
Yeah.
dedicated to putting those bits of information into the system so that you can have every bit of information at a fingertip. I'm saying one of the reasons why we have such serious problems with so let's say for example traffic. I have always been saying since before I left Guyana, you give me a traffic ticket today and I don't feel like paying it, I don't pay it. There's nothing to tell you that I didn't pay it unless you go and dive looking for that specific ticket. If you have everything upgraded and updated in the national data system, then if I am issued a traffic ticket today, the police can know, hey, this guy did not pay and issue a summon for my arrest so that I go pay the ticket or go to court. It doesn't happen. So we're losing revenue like that. That's number one. Number two, like you said, you've taken away the important jobs of people, young people who are supposed to be the future of this country, this beautiful country of ours. And then I want to make note of one critical issue when it comes to Region 10. This government is big on talking about um, development and empowering the indigenous peoples of Guyana. Region 10 is predominantly an indigenous community. It's just that bauxite was taken there and it became an integrated society. So if we're big on empowering indigenous people, why are we taking away the stuff that would empower the people, these very indigenous people in the region? I mean, I'm kind of mind boggled. I'm not understanding it.
Because it's just a system. And I'll make a comparison again. They still believe that you can come, they can go to communities, Amerindian communities, and just do handouts and feel that people will gravitate to that. As against what the coalition was doing, which is teaching you to fish. And so you were allowed to take control of your life. The Bertram Collins College had a number of Amerindians from across the different regions who are being trained, professionalizing the workforce, so that when you go there, things are done in a manner. Why would you choose to close it down and affect those Amerindians? I'll tell you what recently happened in Wiruni. The Tushau approached me. He said, listen, I would have been nominated to run in these elections. I have over 100 members supporting me. You know what they did? They brought up a case some 20 years ago where the man had a minor matter and said that because he had a court matter, he can't run in the elections. Mind you, I had to explain to them that you're innocent until proven guilty. The man never served time. He was vindicated. And what I had advised him to do is to go get a police clearance before the elections were called. He did that. You know, the guy went and won the elections, but they were attempting to install somebody there who is sympathetic to them. They went to Rivers View and they did the same thing. They told the Tushau that he can't run because he was there for a year. And that once you run for a year, you can't run back. Mind you, in other communities in Region 9 and so on, where they have some amount of control, you had persons who served 2 years already and were able to run again. But that is what they're doing, coming into communities. Bishop Wanedjil went into Rivers View, told the people that he was there and he met with a 5-year-old child and asked her if she knows the name of the regional chairman and all of these things. And he had $5,000 to give her. Subsequently, I went into Rivers View because it was an area that was hard hit by the COVID-19. So we were advised not to go there. When I got there and I asked the residents, okay, I hope when Edgel was here, you made mention of him that we
Oh, what a critical point to lose this conversation.
yeah, I got to connect to that. You there?
All right, so we've got him. We've got
You
him
there?
back. We've got him back. Yes, yes, Chairman. We heard up to when
You
you
there?
went into Riverview and you were having a conversation with the people. We didn't hear what the conversation was about.
Yeah, we just had power outage. Sorry about that. Yeah,
Oh, okay.
so I had to switch over. So the people said Edgel was never here. But this guy was on NCN telling the people that he was in Rivers View. And the people said he was never there. So I said, for anything they say. And he was on NCN making this claim. So when I got in there,
Hmm.
10, I can commit that we will bring Rivers View back on the Region 10, that we will make representing in supplies for them. We have been helping them go there. Say about my fourth that the previous regional that the regional chairman was never in Rivers View, fully well knowing it's propaganda you're spreading in an attempt to fool our Amerindian brothers and sisters. All I said to them, set up back the national data management, the NDIA, the internet access that the community was getting. It has been down for the past 9 months. Send in your team to fix it. The erosion in the road and all of the other issues with health and the schools and so on, let's just continue to maintain it, right? We must build upon the successes of what we would have achieved over the past 5 years, not do what they're doing right now. Punishing Region 10 because of it's a community that's predominantly Afro-Guyanese and they normally vote solidly for the coalition. You're just targeting this community, this region, while other regions are getting the resources and benefiting daily from your programs.
Yeah, this is ridiculous indeed. I would have observed that that while they're starving and pressuring Region 10, they are making a whole lot of stuff available to Region 6,
Yeah,
and Region 3. It's and to some extent Region 9. One of the things I want to piggyback on just as we wrap up here, because I know you have a busy day and I've got to let you go. One of the things I'd like to piggyback on is the fact that they felt, or they still feel, that these are the days of yore when you could call the people in an Amerindian community because it is remote and information, or the access to information is slim to none. You can call up anytime and make a claim against them, or you could throw
yeah,
something to people and say, look, I was here and I did this
yeah,
and this happened. But information travels now. People are traveling, and in spite of the poor state of the road, at times, I know at times this is ship shape, and there are times when it's rainy season, it goes real bad. The information travels. So this is not long time when they can get away with that kind of ignorance, and it's
yeah,
it's kind of foolhardy for one to be engaged in such exercises. I remember a situation where a couple of colleagues of mine were sent to teach in the hinterland, and whenever they didn't feel like working, they would tell the people's children, hey, tomorrow is no school, tomorrow is one of the ministers' birthday. They called some minister, but
yeah,
because people didn't know anything like that or about that, they accepted it. So many days the children had no school because the teachers felt like they shouldn't be working,
yeah.
and until they were caught. So in these advanced technological times, how would you tell yourself that it's good for you to fool the people and talk about the nonsense? Any parting comments before you leave, Chairman? I know you have to rush.
Yeah, well, I want to let persons know that we will continue to make representation for them. It's a tough job operating with an administration that seems to be bent on targeting communities that do not support them when it comes to elections. But we are out with the elections is done. Look at persons are asking me about the conditions of our roads. We would have made submissions. The current administration would have slashed the funds that went to infrastructure works in the region from 140 million that we were receiving under the coalition for capital projects to just 80 million here in the region. So now those roads that we would have submitted, you were only going to be able to do about 5 or 6 roads. And then this is information that the community need to be, it needs to be out there so that they will know that we did make the representation. We did put in all your roads, your bridges, your drains, and so on. Agriculture, the farm to market road from Millie's Hideout, that millions were spent under the coalition to upgrade the road from Millie's Hideout to Sand Hills and Kimbia, has just received 13 million this year. And you say that you're big on agriculture. Yes, I believe agriculture holds the potential to create jobs, We do not want to continue to look at agriculture the traditional way, because my plan, my vision is to get young people involved in it by incorporating ICT in it and so on. But how do you defund it and you still expect us to push that agenda, to push that level um, of getting technology involved in agriculture? It's just ridiculous. But we have to remain firm, resolute. Our people, we know that we will continue. Rest assured that we will continue to make representation for you. We have been writing letters on your behalf, whether it's dealing with the Board of Guardians, where under the coalition, 800 people were benefiting from it. What they have started to do, they install a board that has all 8 members are Indo-Guyanese, supporters of the PPP, who Afro-Guyanese, are predominantly a region that is predominantly Afro-Guyanese, have to go before them for a request to be placed on public assistance. They have begun the process of shelving them off with no clear plan in place of transition for them, whether getting them in small business or whatever. So the numbers increased by 800 people who are receiving help. What they have started to do is shelve them off with an all-member board, a member board that has all 8 Indo-Guyanese on the board, supporters of the PPP, and we have not received response from the ministers yet. A single parent who suffered a stroke went to the board for assistance. They told her no, she doesn't qualify. She needs to go to Linden May and Town Council for a loan. That's how blatantly they are discriminating and disrespecting our residents here in region. But we will continue to fight for them and keep you and other members of the public updated on what is happening in the region from time to time.
Thank you so much, Mr. Regional Chairman, and I look forward to a part two of this discussion. I'm going to get some other information up, and so we can have another conversation at your convenience. Thank you so much again.
Right. Thank you. Welcome.
You're welcome, sir. All right, so that's the very busy chairman of region number 10 in Guyana, Mr. Deron Adams. I'm not sure if he has any relation to Sandra Adams. They're both, you know, big structured people. They look like they can take the licks that are being rained down on them. I know Sandra wasn't easy. Sandra held her own. But this is the plight we're experiencing all over again. It's just so sad that we were at one stage in life far removed from the democratic process, far removed from a democracy, what a democracy should be. And then today, this is where we are. Remember, this is a in perspective show. We are a show on which we share news, we disseminate bits of information that have been making the news. We have been having interviews with people who are of import to the various communities in Guyana, not because of a name they hold, but their influence in the society is one that merits our quoting them and to us having discussions with them in relation to what is happening in those communities in Guyana and in the country generally. Uh, we look forward to more of these interactions. This is how a lot of Guyanese get their information. The thing is that when you watch the news, you get the highlight of a situation, but you do not get the depth of information that we share here on or we glean from the conversations we have here on the In Perspective show. You know what is sad? I I learned that some people are so envious of the show. Lots of people are. Lots of other hosts of shows are. But there are some people who are so envious of the show that they're making some very ludicrous remarks about the show. But I'm happy that you have been logging on. You have been finding our interviews and our discussions interesting and beneficial to the extent that you've been learning stuff. And I would like to, because of this interview and the one that I held the other day with, or I had the other day with the mayor of Linden, I would invite the people from Linden to coalesce around your mayor and your regional chairperson. Let's throw in as much as we can to help them. If you can donate stuff to the administration, go ahead and do so. Make contact with them and do so. If you can donate stuff to the mayor and city council for the benefit of the people of the community, go ahead and do so, because at the end of the day, it's not the government who's benefiting. They will never be able to benefit from your donation in whichever way. The only thing they can say is point to the fact that Linden is moving ahead, Linden is going forward, and then people will be able to say to them, not because of you, Linden is moving ahead because of other people. And then we can faster be in a position to kick these people out of office because they're not truly representing Guyana. I'm saying you're in government, govern the country. Please, by all means, just govern the country. You sought to be there. Thief whatever money you want, but don't let the people know. You go ahead and thief. When you get catch, you get locked up. That's your business. But manage the country. Just govern the country. Treat everybody fairly. It is disgusting to see what they and then now to note that you have people who are being paid with the state's money to manage the affairs of the people, the state's affairs, to manage the affairs of the people, and people coming before you for you to do your job and give them assistance, and you're going to blatantly tell them, go to the mayor and town council. Listen, I don't want to say what should happen to those people. Linden people are too nice. Guyanese generally are too nice. Too nice. It's ridiculous. Govern the country. Stop doing nonsense. Stop victimizing people. Just govern the country. That's all people are asking you to do. We don't have a problem with which party, government, and all that. We're asking for the people to be governed fairly, across the board. Come on. And then you have a flood. I remember, same thing in 2005. We believe that they deliberately flooded the area because, listen, I'll tell you again, when we got down to the brass tacks, I mean, this is a different situation. This is a riverine community, but we're talking about how they deal with these situations. Somebody opened at a certain point along the Conservancy Dam in the Enmore area. There were two intake valves on the Conservancy. The one at the top, which had a screw worm control, it was locked. So when the people went and checked it, they realized, oh, it's locked. So where on earth are we getting the water from? But we insisted that people go check it. And when they checked, they realized that there was a second intake tube below that one, immediately below that one. And that one had no valve. So somebody placed it there and was deliberately letting the water in to flood the entire East Coast. And the problem with the East Coast is that the lowest villages on the East Coast are those villages that are inhabited by people of predominantly African descent. So those areas suffered heavily. They don't mind flooding out some of their people. Some of their people will suffer, but the majority who's suffering are others. So this is the situation, and they never came. They never came until we, the people, made a whole lot of noise about their not being there to check. Like I said before, the officers of the various ministries would come, but the elected people themselves never showed up until pressure came to bear. Look at these images. These are structures that are covered. Look at this boathouse. Look at this boat shed. It's covered. I mean, like, why won't you want to go to an area like that with, I mean, like, dispatch? You should be there with dispatch. This is a serious flood situation. This is a covered structure. Look at this boat out there, fully covered almost. And then there was another one I saw a house or houses. Some houses were almost up to the floor. Those were houses on stilts, raised houses, and those houses had the water up to the floor. And you're not going? Look, you just passed one there. Almost, look, this one here is almost, the bottom is almost covered. And you're not going? Come on, people. This is ridiculous. This is ridiculous. Where in the world? Look. This water is almost at the floor of the house. Why would you not want to, as a politician, rush to the aid of these people? But I want to let you know that at the same time, you check because the water level is high there. You check and see what they're doing at the back of the Mahaico River and the Maikoni River. Mora Point and these places, check and see how many of them have gone in there. Look at this. The house is almost underwater. The building is almost underwater. And you're saying that the elected officials refuse to go? Oh, come on, man. When people talk, these people are angry. This is what Sarah Lynch needs to see and talk to her government about. But instead of doing that, she's running around the place talking a whole bunch of nonsense with fishermen and all these people. Sarah Lynch needs to get her hind self out of Guyana and go find a job someplace else. So we're going to start lobbying for her to get kicked out of the place and put somebody who's genuinely going to represent the interests of the U.S. government in Guyana so that the government can have a genuine picture of what's going on in the country. All right. We've been on for what, 1 hour and 40 minutes so far. I've got to make this space available for another member of the family who has to do work from home. My job here for the morning is done. And then I've got to rush across to the hospital to get myself sorted out here. But in the meantime, don't forget to make your donations available so that the bills can continue to be paid. The Cash App handle is there, $ Bloco BP2. Then you have the PayPal link. I have not checked that link to see if anybody has used it. byproductions at gmail.com. And then you've got the Venmo at in_perspective. We've had a nice discussion with the chairman of region number 10 in Guyana. It's kind of mind-boggling. This is disgusting to the highest extent. I mean, come on, people. We've got to pull ourselves together. Guyana is better than that. We Guyanese are better than that. Far better than that. We can do better than that. As you folk on Friday morning, we have a discussion with lined up. We have a discussion with Mr. The Honorable MP Kemraj Ramjatan, Prime Ministerial candidate for the coalition in the 2020 elections. I am eagerly looking forward to that discussion. Thank you very much for tuning in, and I trust that I'll see you on Friday morning. Have a good day. God's richest blessings to you. For now, until then, Branford Burke, your host, saying, stay safe, be well, take the vaccine if you can, keep yourself masked up, and if you're not doing any of that, social distance. Bye for now.